This is our sixth briefing on COVID-19 status update, which is happening today, the 9th of April 2020. Ladies and gentlemen of the press, good afternoon and welcome to our routine briefing on the status of COVID-19 in our beloved county of Mandera. Mandera County government continues to be on high alert following the reporting of the first two index cases of coronavirus which tested positive 2 days ago. We continue to step up surveillance, detection and response, and are well aware that we have a weak health system inherited after 50 years of underinvestment in the health sector by successive governments. We are alive to the fact that we have long and porous borders with both Ethiopia and Somalia, with many unmanned crossing points. Screening of passengers continues and monitoring of border crossing points at Bulla Mpya and Malkasuftu, as well as in other border crossing points across the county, continues as part of our surveillance measures. We urge the public to understand that the county government regular briefings on COVID-19 is the only source of verified information in the county besides the National Ministry of Health updates. We urge the public to ignore anyone sharing unverified information on COVID-19 purporting to be from Mandera County on coronavirus pandemic. We are required to report all COVID-19 related incidences, but we have no control over records outside the jurisdiction of the county government. We plead with the public and the social media platforms to be sensitive to the patients under treatment for coronavirus, healthcare workers offering care, and to stop stigmatizing and traumatizing their families. We all want to be paparazzis fighting to be the first to report, yet we are sharing inaccurate information which is dangerous and criminal. Ladies and gentlemen, these are difficult times. Coronavirus is like an invisible enemy that does not differentiate between the young and the old, men or women, rich or poor. You have seen it. It is a disease that knows no boundaries or religion. It infects leaders like myself and anybody that comes into contact with it. The disease does not even spare doctors and nurses. It can be me today and you tomorrow. We are handling these challenges as professionally as possible. Sometimes, because of the multi-agency approach we use, some gaps may occur. We have never handled an emergency of this nature and magnitude before, and we keep countering gaps, but we are determined to do our best. COVID-19 is testing the limits of societies and all counties across Kenya. We are rallying all possible resources, including finances and personnel, to meet immediate health needs and scaling up social protection programs, which will begin with food production to the most vulnerable families within the next 1 week. As of now, the two patients under our care continue to improve. They are doing well. The fever has subsided, the coughs have subsided, and continue to receive medication under the care of our dedicated healthcare workers. As of today, and looking at the improvement over the last 4 days, there is great hope, inshallah, that they may recover fully very soon. Contact tracing of passengers who travel in the same bus with the two patients continue despite challenges of patients who disembarked midway before reaching Mandera, as well as those that do not have phone contacts or their phone numbers were not captured against the manifest. I would like to assure the public that we are making very good progress with contact tracing for the bus and others who may have made contact with those patients. Despite the progress being made, we have run short of sample collection kits We have more than 30 people in quarantine, but we have no kits with which to send samples to Nairobi. We appeal to the Ministry of Health to urgently avail the kits to enable us forward samples for testing. I still make a fresh appeal to the National Steering Committee on COVID-19 to help Mandera set up a testing facility or consider availing a flight to help with movement of samples to the nearest testing facility in Nairobi, which is 1,200 kilometers away. This situation was occasioned by a presidential order on lockdown of travel into and from Mandera, and subsequently all flights and public transport to Mandera and back to Nairobi are grounded. Ladies and gentlemen, I would like to commend the management of Bulla Mpya nursing home, which quickly referred the case of the 2 patients to our COVID-19 response center. We urge all private health service providers to emulate the gestures this war against coronavirus requires concerted efforts and isolation to guard against sharing of facilities with other patients. I would like to commend the good job they have done, and we are going to give them a letter of commendation later today for good job that they have done. We also want to urge the public to make sure they share information of patients that have manifested symptoms of coronavirus as soon as they get to notice, in order to make sure that timely response and isolation can be done. Remember, coronavirus does not move by itself, it's moved by people from place to place. Despite the ban on travel to and from Nairobi, we are reliably informed that unscrupulous transporters have positioned themselves in strategic places outside Nairobi metropolitan borders and still embark on travel to Mandera. We urge our enforcement partners to help us ensure lockdown orders of His Excellency the President of the Republic of Kenya, President Uhuru Kenyatta, are fully implemented to the letter. Travelers from Nairobi are still sneaking their way into Mandera, posing a huge risk to spread a huge risk in the spread of COVID-19. Today, I hereby direct the following. I hereby direct that following the 2 positive cases of COVID-19 reported in Mandera, and in line with the recommended best practices of controlling the spread of coronavirus, we do not want to expose our staff who are not in essential services category. As such, I consequently direct that they work from home and stay safe. They are further advised to practice social distancing, regular hand washing, and to cover their coughs and sneezes, as well as other recommended best practices. Where necessary, it's recommended that they wear masks while visiting public areas. However, we want them to stay at home. The staff of the county must lead by example and be ambassadors of hygiene in the fight against coronavirus. The directive on work from home does not apply to staff in the essential services category. The essential services category includes staff in the Ministry of Health Department, Ministry of Water, particularly supply and maintenance of teams of Mandera Water and Sewerage Company, as well as other supply teams in the Ministry of Water within the county. Ministry of Finance critical services staff, including special programs team and all revenue department staff. The fire brigade and the municipality sanitation and greening and enforcement teams will remain on duty. A select team of drivers who support the COVID-19 response across the county will also remain on duty. Non-essential staff will work from home going forward, and are urged to observe advisory on hygiene and avoid travel unless it is absolutely necessary. All staff are directed to seek clarification on the same from their county executive committee members and respective heads of departments and line chief officers for avoidance of confusion. And it's important to note any such stay home must be supported by a written permission from authorized person. Consequently, Mandera County government will shut down operations and concentrate focus on COVID-19 detection, prevention, intervention, and response. The gates to offices will remain closed to public, and those with urgent issues are advised to send their request by email to offices or through our telephone lines addressed to the county secretary or the respective department involved. Our COVID-19 emergency lines will remain in service on 24-hour basis. Finally, countries that have succeeded in this fight against coronavirus are those that practice early lockdowns to restrict the spread. COVID-19 doesn't spread by itself, but spread through movement of people. As such, we have been left with no choice but to order lockdown within our county. All public transport except those transporting food and other essential goods must be stopped with immediate effect. That includes movement inter-ward, inter-sub-county, and movement between villages. The security teams must enforce this order and mount checkpoints on all roads, including those that are serving other counties and neighboring countries, with immediate effect. Failure to lock down public transport will only mean expectation of mass death within the county and neighboring regions, including our international borders. Thank you very much, and I would like to take this opportunity to invite my brother,